Hi, everyone who's joined. Looks like we only have 4 of you, and we're all county employees. We are just doing some AV testing, so if you would bear with us.
Testing, testing. Can you hear me? Perfect. Awesome.
Would you mind to try your camera for me?
Oh,
Perfect. Thank you.
all right. Testing, testing.
Gotcha.
Okay. There we go. Okay. Testing, testing. All right. And camera. Oops. There we go. All right. Thank you.
Hi, Joe.
All right.
Paula, would you mind to turn off your mic
Yep.
and your camera? Great. Tracy, just let me know when you're ready to test. And then I'm going to start with introductions. Good evening, all. My name is Lilia Neville. It looks like we have about 40 people joining us right now on GoToWebinar. If you're unaware, we're also live streaming tonight on Facebook Live. So thank you to everyone who's joining us tonight. So I'd like to start with a brief agenda. We're going to hear from County Administrator Joe Kirby first, and then we're going to hear brief introductions from each of our candidates. Then we're going to open up the Q&A period. We had planned on opening up the Q&A period with the Benton County Human Resources Director, Tracy Martineau, but like all great things that COVID has brought us is nimbleness and flexibility, and so we've had a bit of technical difficulties. So we're going to go with a plan B for that. But at the end of this evening, all participants are going to be able to submit their feedback about the candidate presentation as well as their responses to your questions. When we close the GoToWebinar, a screen's going to pop up and you're going to have an opportunity to complete a survey at that point. If someone you know is unable to join us tonight live at 5:30, we are going to make a recording of this available on our Facebook and our YouTube channels. And that feedback form for individuals who can't make tonight's webinar is going to close Monday morning at 8 a.m. So folks will have the opportunity to watch the recording over the weekend and then provide their feedback. So this evening, I'm going to be joined by Joe Kirby, County Administrator, as I had mentioned, and it is my pleasure to introduce this evening's panelists. So I would like to begin with Leanne Jolin. Did I pronounce that correct, Leanne? I hope so.
You did get that exactly right. Thank you.
Wonderfully, wonderful. So Leanne is the Executive Director of the San Juan Basin Public Health, which is the public and environmental health agency for Archuleta and La Plata counties in Southwest Colorado. Also joined with us this evening is Paula Mandel.
Oops, technical difficulties here.
No problem.
There we go. Hello, nice to meet you.
Great. So Paula is the Public Health Deputy Director of the Pima County Health Department in Tucson, Arizona. All right, and our last candidate with us this evening is Lindsay Rogers. I would like to note that there is a D in Rogers, and my sincere apologies for that misspelling.
No worries, thank you. Hello.
So Lindsay is the Associate Commissioner of Health and Developmental Services at the Health and Human Services Commission in Austin, Texas. So thank you all for traveling to be here with us in Oregon. And Joe, how about you kick us off with a few words of welcome and perhaps a brief overview of our recruitment process so far.
Great, thank you, Lilia. Good evening, everyone. It's a pleasure to have you join us. I really appreciate you spending time with us this evening to get to know our top 3 candidates. Public input and stakeholder input is extremely important to the process. Myself and a small hiring panel will be reviewing all of the comments that you provide this evening, so I really encourage you to take time to submit your thoughts and opinions on each one of the candidates. A little bit about our hiring process is we did hire a firm, a recruiting firm that is, by the name of Peckham & McKinney. They did a national recruitment. We ended up receiving a total of 28 applications. The recruiter by the name of Drew Gorgay in turn did preliminary interviews and narrowed that group down to a recommended group of candidates to the county of 7 candidates at that point. A small hiring committee and myself then in turn narrowed the group down to 5 candidates, at which time we did in-person interviews with 5 candidates. When I say in-person, those were actually go-to meetings. The 3 candidates that are here tonight were the 3 finalists from that group. They're very competitive candidates, and I'm really pleased that they've chosen to join us for this presentation this evening. And I think you'll find out shortly why they quickly rose to the top of the applicant pool. Once again, stakeholder and community input is essential in our decision-making process. So once again, I encourage you to plug into those links that have been provided and ensure you're submitting your feedback for us. On that note, I would just like to thank our candidates tonight. It's a stressful process. It's an extensive process, and they still have one more day to go after today. I will be trying to expedite a decision and coming to a decision hopefully early to middle of next week. And I look forward to the rest of the process and for our hearing from our candidates tonight. Thanks, Lilia. Back to you.
Excellent, Joe. Much appreciated for that overview. So as I mentioned, we're going to provide an opportunity for our candidates to introduce themselves and speak a little bit about their background with you all, members of our public. So I'm going to introduce each one of the candidates and allow them to provide 5 to 7 minute presentation, and then we're going to move into our question and answer period. So why don't we start again with Leanne. Leanne, again, is the Executive Director of the San Juan Basin Public Health Agency for Archuleta and La Plata counties in Southwest Colorado.
Thank you so much for the introduction. And I want an audio check. Can you guys hear me okay? Okay, it's just, it's a little difficult. Thank you. Okay, so my name is Leanne Jalan, and I am the Director of San Juan Basin Public Health in the southwest corner of Colorado. And I do want to start by saying thank you so much for the opportunity to introduce myself and share about my experiences in public health and in my interest in coming to Benton County's health department. As I said, I currently direct San Juan Basin Public Health. We're a local public health district that serves 2 counties in southwest Colorado. And I also currently serve as the president of Colorado's Association of Local Public Health Officials, which represents the 53 local public health departments serving 64 counties across the state. The reason I am in these roles is that I strongly believe that it is a fundamental obligation of government to promote and protect individual and community health. In the last century, life expectancy in the US has increased by 30 years. So many of these additional years are attributed to public health measures, things that we do together rather than advances in medical care. And you know, some of the studies really demonstrate that 25 of the 30 years that we've gained in life expectancy in the US is public health prevention and protection from disease. The ways that we do this are through things like clean air, clean water, less smoking, better nutrition, as well as public health activities to contain communicable disease. The ways that we contain communicable disease, things like disease surveillance and investigation, including contact tracing, the things that we've all learned so much about in the last few months are one portion of what we do in public health, but all of the pieces work together to improve and lengthen lives. Unfortunately, this work is often underfunded and invisible. While I know that Benton County has been working hard on a health and all policies lens with many departments and many communities partners, I do think it's real and important to acknowledge at this time that the public health system that we work in is not in a steady state and we are not in normal operations. We have a huge task at hand to contain COVID in our local communities, to save lives, to open schools, and to recover our economies. Together, the work that Benton County has been doing for health and all policies with all of its departments and all of its community partners is going to be a foundation that will position Benton County to be successful in this work. And that's a huge good news piece of the story and why I'm interested in Benton County. The bad news, though, is that across the US, you know, in the last 10, 15 years, beginning in the Great Recession in 2008, there was a huge chunk of resources that disappeared out of public health. We lost in the public health world about a quarter of our workforce and never bounced back since the Great Recession. Committed agencies and committed staff, like the staff that I've met here so far in Benton County, has found creative ways to serve communities and continue this work, budget cut after budget cut. But at this time, public health operates in the US on about 60% to 2/3 of the resources we need to meet basic needs for promoting and protecting health for everyone, everywhere. This is only more challenging with the pandemic that we're all facing. It's in this climate of not enough resources that public health departments had to really reconfigure a weakened infrastructure to respond to what the community needs from us. And I know that here in Benton County, health department staff were pulled from other functions and other programs in order to respond. And unfortunately, pulling staff from usual activities is going to have fallout in these times, considering that we're going to have economic, we're having economic fallout, right? So this is going to create kind of a vicious self-perpetuating cycle where we had to move people from health roles and responsibilities to response roles and responsibilities, which then interferes with the ability to successfully control communicable disease. So the trick going forward for Benton County and for all of us in health is, how do we reshuffle to do the emergent COVID work that we need to do at the same time that we're advancing the many issues that Benton County previously identified as needing to address to improve health equity for the community? So what do the challenges associated with containing COVID reveal to all of us about what works and doesn't work in our community? How does this relate to health equity, and how do we use this moment in time, which I think unfortunately is a really long moment in time. I'm sure all of our public health officials would agree. It's a long moment, but how do we do both and bring the pieces back together? So thankfully, the Benton County Public Health Improvement Plan had already identified food security, housing, quality of housing, everything on the spectrum from homelessness to workforce housing, individual and community well-being, and communicable disease as its priority areas. So this is proving to be a very prescient decision by Benton County, and it's an understanding of how all the pieces of a public health system work and all the ways that we as public health practitioners are trained and charged to ask, how did we get here, so we can make the right improvements for the community. This is how we in Benton County and every community across the country is going to need to marshal resources for the tasks at hand, because COVID again and again proves that communities need good communication, outreach, education, wraparound services, and honest, hard conversations about institutional bias, including structural racism, to improve health outcomes for individuals, families, and communities, and help our community members successfully stop the spread of communicable disease. This is a big balancing act right now. It is full of challenges and enormous opportunities for Benton County. The work that I have seen here demonstrates that the public health practitioners in this community are already doing yeoman's work to integrate the huge responsibilities of detecting and responding to disease, and also maintaining an acute awareness that the ongoing integration of this work is going to be necessary to position our priority populations to succeed. I think I'm probably out of time. I didn't time it. Yeah, okay. All right. On that note, I'm just going to say that, I'm thrilled to be here learning about Benton County and thinking about how all of these pieces can connect to improve health in the community. Thank you.
Thank you, Lee, and I really appreciate the passion with which you spoke about your comments. I think that those are some really relevant and timely important thoughts about health prevention and health promotion, so thank you. Okay, so now we're going to move on to Ms. Lindsay Rogers. Again, Lindsay is the Associate Commissioner of the Health and Development Services at the Health and Human Services Commission in Austin, Texas. Welcome, Lindsay.
Thank you. So I'm going to use my 5 to 7 minutes to give you a little bit of my background and perspective, and to know me a little bit as a person, and so much as I can share that behind the mask here. I apologize you can't see my smile. I would love to be having that sort of exchange virtually with you, but I am a native-born Texan, grew up, born and raised in Houston, and I first pursued a degree in dance before I went into public health. And I fortunately still participate in ballet to date, and really enjoy using that as a physical outlet. I went on to become a registered dietitian and have a master's in health education, all from the University of Texas at Austin. And I ended up moving into public health nutrition as sort of the entree into the public health world and public service. I began in obesity prevention at the state level for chronic disease prevention, looking at community engagement and capacity building for strategic planning and implementing systems that support access to affordable, healthy food and community-wide breastfeeding support. So both evidence-based interventions, but also building structures and systems that make those choices easier for everyone in the community to participate in and have improved health outcomes for. I've spent the last 14 years in executive leadership roles in the state of Texas at various state agencies. I was the Texas WIC director for the state of Texas for 3 years. I was the deputy associate commissioner in the food nutrition division at Department of Agriculture. In that role, I oversaw 12 federal USDA nutrition programs for the state of Texas, including National School Lunch, school feeding, and child and adult care food systems. In my current role, I'm the Associate Commissioner for Health and Developmental Services. And in that role, I have 10 safety net health programs that are statewide administration. One of those is the WIC program. The other big one is the Early Childhood Intervention Program that serves kiddos birth to 3 with developmental delays and disabilities. And the 8 others are unique sort of niche programs that either serve those with a certain condition that doesn't have good coverage. So for example, autistic children that may not have great coverage for applied behavior analysis services, we provide that service for them. Or they may fall in the category of being underinsured or not insured at all because they're not otherwise eligible for some of what the state offers. And so in that way, I have sort of throughout my career followed a path of service to others, oftentimes through a nutrition thread, but always in the realm of trying to improve health outcomes for those that we serve. It's given me a really unique vantage point to be at the state level to see the connections across different systems and programs. And one of the main reasons I applied for this position is because what I don't get at the state level is that direct connection to the community. I have a lot of responsibility to engage directly with stakeholders and hear from local health departments what they need from us for support and guidance and policy change. But I'm not marred in the community, where you really can be side by side with those stakeholders and making tangible change and seeing the change or the barriers to the change that you can influence and affect with a hands-on approach. So that's really what appeals to me about Benton County and the opportunity that's provided here. I also will just share, I've been married for 15 years. My husband was out on his mountain bike through your town today and had a great time enjoying the bicycle infrastructure here. I have 2 little girls. Opal is 11 and Pearl is 9. And we are a family that loves the outdoors. We spent a week in Arch Cape on the coast of Oregon last summer and fell in love with what your state has to offer. And so those drivers, together with my career aspirations, are the reason that I'm here and had put my application in for consideration. I want to thank you for the process. It's been extremely thoughtful and strategic. I have definitely never been through a process that has really been so thoughtful and how it engages not just the employees and leadership within the organization, but the broader community as part of the selection and the input. And I think it speaks volumes to what Benton County does in terms of their mode of operation. So thank you again for the opportunity to speak with you tonight. And I will turn it back over to Liana.
Thank you, Lindsay. That was really nice to hear a little bit about your experience at the state level and your desire to be more local and connected to the community. Between GoToWebinar and Facebook, we've got about 65, 70 individuals watching tonight. So our community is certainly involved with our organization. So that's great to hear.
Excellent. Thank you.
Okay, so we are going to move forward for our final introduction and presentation from Paula Mandel. Hi, Paula, take it away.
Thank you. I am very excited about the opportunity to be here, and I'm going to move along the path as Lindsay and kind of tell you a little bit about my background. I am a registered nurse. I grew up in the Midwest, and so I fell in love with community health and public health when I was in college. At that time, and unfortunately, I think even now, as nursing students are starting to look at their career path, they are really encouraged to go into the hospital setting. And so I did at that time. I ended up going into critical care. I loved critical care. I was an open heart and transplant nurse. I moved into management and oversaw two ICU units, a step-down unit, and a cardiac cath lab, and did that for about 5 years. And then I decided we were lucky enough to be able to allow me to stay home and be mom for a while. And I enjoyed that. And when it was time to think about going back to work, I knew at that point in my life I really didn't want to do management, and I didn't want to go back into the hospital. I wanted to do something different. And there was actually an opening for a public health nurse in Hamilton County, Indiana. Hamilton County is a population of about, at that time, about 250,000. It was one of the fastest growing counties in the state of Indiana. You saw both extremes of the community. It's where a lot of the Pacers, a lot of the Colts players, Eli Lilly, Roush, Rolls Royce. But then we also had a large immigrant and migrant family in Hamilton County. So I think it was the best place for me to really get my feet back into the public health setting. And while I was there and relearning my public health nursing love, I did a variety of things. And then I had the opportunity to move in and become the director of nursing for Johnson County Health Department, which was about 180,000. And I stepped into that role just as H1N1 was happening. And that was an interesting year. And it was really, I think, eye-opening and engaging for not only the department, but for the community, and really working on those community relationships. So I loved that opportunity. My husband was offered a position in Tucson, Arizona with Raytheon. And so we moved to Arizona about 10 years ago. And when I went into the health department at that time, I started as a nurse manager in one of their clinic locations. I then moved into, or was asked to write and help develop an implementation plan for Nurse Family Partnership, which is a maternal child home visitation program that is evidence-based. It works with first-time moms. And there are a variety of goals that the program implements. It was a wonderful opportunity to bring 6 nurses in to work with those mothers. The majority of our mothers were low income. We started a relation. There's actually 2 tribal nations in Pima County, and so we started a relation with both the Tohono O'odham and the Pasco Yaqui nations, and supported their mothers with this program. And after a period of time, we were doing some restructuring within the health department. We were really looking at taking the health department into public health 3.0 and looking at the pillars of community health, public health, and community collaborations. And we really felt that we needed to begin internally, and we decided to work at collaboration. And so I was asked to bring our public health nurse division and our clinical services together into a new division. We worked on talking about what collaboration looks like, what a no wrong door policy looks like. And so any client that walked through our door, no matter what program they were engaged in, our staff were learning a new culture, and they were assessing what is another program or any other program that we do within the health department that this client might benefit from, and making referrals. And so I was really excited about that. I think we did a really good job. And then 3 years ago, I was asked to apply and interview to be the deputy director for the health department. Pima County has a population of over 1 million. We have 6 divisions within the department. I work with 6 amazing senior leaders. I love the piece that I've done as the deputy director, but it was interesting going through this emergent response that we have with COVID. It's a time of unknown and a lot of change. And what I found is some of our staff, as they were beginning to think about coming out of this emergent response, they were doing a lot of self-reflection and thinking about, there's some things that have been concern for me of how our programs are being implemented, or I really know this other position within the department and I think I'd like to try that. And so they had conversation with myself, with the health director, with their senior division managers, and some of them are walking into new roles or they've applied for new roles. It kind of got me thinking about, what are the next steps for me? It seems like a crazy time to transition and to take on new tasks. And I've had people say to me, why would you want to go from one frying pan into another frying pan? But it's time for me to look at my professional growth and development. And the next step for me is to try to serve in that health director role. I really see every piece that I've done in leadership is a serving piece. I was very excited about Oregon. I kind of fell in like with Oregon about, it was in 2014. I went to a national conference, the American Public Health Association conference. At that conference, they have an expo center. And at that expo center, there are numerous colleges and universities that are trying to encourage people to come and attend, their campus setting. And I stopped at the Oregon State table, and I just was so impressed by not only the faculty from the university, but by the students. And they were just talking about, and you could tell they were so passionate about the community. And I kept saying, so are you from Corvallis, or where are you from? And the majority of them were not from Oregon. The majority of them were not from the, actually even the West Coast. And so to hear that excitement and passion, and that they loved not only the community, but their campus so much, it really left an impression on me. And I knew that they have an amazing school, especially School of Nutrition. So I tried very hard to encourage my son at that time, who was looking at colleges and universities, to think about maybe coming to Oregon State. I told him I would even move with him so that we could establish residency and we could get in-state tuition versus out-of-state tuition. But I couldn't convince him of that. And so I fell in like within that during that time period. My mother actually lives here in Oregon. She lives in Klamath Falls. And so I also saw this as an opportunity to get closer to her. When I have been reading about Benton County for, probably since 2016 with my son, I know Oregon is very progressive with public health. I've seen Benton County be very progressive in public health. When you see a county public health department that's being talked about by Duke University, that's being talked about by the de Beaumont Foundation, you know that you are looking at a department that's very passionate about public health and about its community and how they serve that community. So there's many things that I've seen, both reading on your website, engaging with the community over the last 12 hours, and then listening to the staff today talk and see their passion come through during this interview process has just intrigued me more. There are so many pieces that I've looked at and thought, even if I don't get the position, you always walk away with an experience. And I'm like, I'm going to steal that little piece and I'm going to take it back with me. And I'm going to see how we can implement that in Pima County. So it's been an amazing opportunity. It's a beautiful, I love the 4 seasons. So coming in yesterday and it was beautiful and cool and it was at 112 degrees. And today there was rain. I've just been in heaven. So I've really thoroughly enjoyed the experience. I can't thank everybody enough.
Thank you so much, Paula. I'm very glad to hear that you enjoyed this morning's unusual rain, because we sure do get a lot of it later in the year. And I also really appreciated you speaking a little bit about your desire to transition, because despite COVID, we still need to follow our ambitions and our dreams. So I really appreciate you hitting on that. So time check for all of our attendees out there. We're about 30 minutes into our event tonight. So that means we have an hour left to answer, well, for me to ask, not answer. The candidates will answer your questions. So it seems that most folks on GoToWebinar have figured out how to submit questions. If you haven't, go ahead and just submit them through that chat function. We have had several come in, so I don't think we're going to have a problem filling up the whole hour. But before I get into your questions, I thought I might give the candidates a little bit of a breather. And they've had such a strenuous day today. They started out their day with 3 different panels. And then I think that they got a little break, but now we're putting them on camera tonight. So I thought I would start with perhaps an easy but telling question. So Lindsay, let's go with you first. What would you consider to be your guilty pleasure or most binge-worthy TV show that you're into right now?
So that's an easy one. Top Chef, by far.
And
And
love that.
That's probably my foodie background, but I obsess over watching that show. And it's not the drama between the characters, it's the food creation, right? So definitely Top Chef.
So follow up for you. What judge would you pick to be?
Padma.
Obviously. All right. Paula, how about you? What would you consider to be your guilty pleasure or most favorite binge watching show these days?
Oh, sorry. You know what? I don't watch a lot of TV. So I really can't answer that question. What my binge is, I love arts and crafts. And so I love to bake. I have not done a lot of baking because it's very difficult to find. I don't know about here, but we've had a difficulty with finding flour and baking soda and cream of tartar and all of those things that you need for baking. I love to knit. I love to crochet. I love to embroider. I love to garden, but I'm not very successful doing it in Arizona. I have a green thumb and it's really hard to grow anything in a desert. I'm getting better with succulents, but those are my guilty pleasures, is when I can do those things.
Well, I just have the biggest smile on my face because I myself am an avid crafter and I have bedazzled my face shield.
It was beautiful.
So I just wanted to bond on that a little bit. Okay,
Yes.
so we'll get a little bit serious now that we took that break. So Leanne, actually Leanne, we need to hear from you about your TV show. My apologies. Would you mind to share that with us?
Yeah, I had a few minutes to think about it, so I'm thankful for that. And I will say that if you, any public health professional right now who's binge watching TV is lying, because we are we're working 24 hours a day and staring at the ceiling when we should be sleeping. So to start, but back when I used to watch TV, my guilty pleasure was absolutely Orange is the New Black. And since I also, I got the preview on the questions, I'd go with Tasty. You guys remember Tasty? Yeah, she's hilarious. And pretty much, I mean, if I could come back as a comedian instead of a public health professional right now, that would be awesome. Because there is nothing funny about our jobs right now.
No, I find myself laughing at inappropriate moments and reminding others that laughter is a coping mechanism. Yeah. So let's move into our more serious question. So we have had several come in through GoToWebinar. I just want to remind our Facebook Live viewers, you can also submit questions. Just go ahead and submit them as a comment and we'll go ahead and get them answered for you. So I'm going to start off with a question for Leanne. We know that public health is dramatically underfunded. What steps will you take to educate and advocate for funding of public health services in the community, region, and state?
I think that's a great question. And, I think as we described in our intro, I think many, many more Americans now know that public health is dramatically underfunded. So we've already have a huge step forward, unfortunately, due to the events of the last 6 months that we've all been responding to together. I think that, it has to be a multi-pronged effort. We need to advocate on the federal level. We need to advocate on the state level. I know that the Oregon State Legislature is having a special session here upcoming to, examine what is going to be possible in the state of Oregon going forward. And then the other piece of it is working in the local community when, it's establishing the relationships, working on the collaborations and understanding that there are pieces of it that we do in governmental public health, and then there's also pieces of it that we do with community partners by exploring those relationships and kind of spreading the opportunities across the community to work together, through health and all policies like Benton County has chosen, but in lots of arenas. There's not going to be one single answer for how we improve funding.
Excellent, thank you. Paula, my next question is for you. How would you engage with other departments in the Benton County organization to address complex issues and pursue cross-discipline goals?
Going out and meeting the community partners and learning more about where they are at this time, what the partnership has been with the health department, and then talking to them about okay.
Gotcha.
All right.
Hello all, if you could just bear with me while I help Paula out. Okay, Paula, go ahead.
Thank you. Can you repeat that question again?
I would love to. Okay. All right, Paula. How would you engage with other departments in the Benton County organization to address complex issues and pursue cross-discipline goals?
Okay, perfect. I think it's really important when you walk into a new role and you walk into a new community that you take time to meet those community partners, that you take time to hear their story and where they are at this moment and what the relationship with the health department has been in the past and with county administration and with other community partners. And so once gleaning information from that, I think it's really important to do ongoing conversations with those community partners, really again looking at the community health assessment, the priorities that were met there, how is the health department and those community agencies working to collaborate on those partnerships. And I think communication is the biggest piece of building relationships, and it has to be consistent. I think you have to go into any type of a collaboration and a relationship with an open conversation to take time and be reflective in the conversations that are happening with those partners, and then providing feedback and making sure that you're hearing the message about what they see as their priority and how you can collaborate with those community partners. I think COVID has taught all of us to learn how to work better with our community partners. I've been very happy with the new relationships that not only I, but our department and our team has developed over the last 5 months with law enforcement, EMS, fire, with the hospitals, the CMOs, CEOs, in the hospital setting with our federally qualified health centers, and with our long-term care and assisted living, with our schools, and with our homeless coalitions. So many groups have been impacted by this and will continue to be impacted by the COVID response for months on end. And I think we're going to have to continue as we go from an emergent response into a sustained response to have those ongoing conversations, to work together on our ongoing health policy groups, and on the services that we can share, the funding that we can leverage with each other in order to continue to provide some of the wonderful services that we've been doing at this time.
Thank you, Paula. And my apologies again about your microphone. All right, my next question is going to be for Lindsay. Lindsay, public health employees have a desire to improve the health of their community. Over time, we lose the knowledge and expertise as our staff retire. How would you address finding talented employees and retaining valuable existing staff while having to compete with the private sector?
That is a great question. I will say that in the position that I'm in now for many years, my area has prioritized workplace culture as just as important, if not more important, than the programmatic outcomes that we set out to achieve. I fully believe that the culture and engagement that we create in the workplace is actually what makes the work drive toward innovation and sustain long-term change for the community. And so if I were to be selected, the way that I would approach some of the context within your question is to make sure that it's not just our obligation to respond to COVID. It's not just our responsibility to look at what we can report as measurable outcomes within what's happening in the community. Our first and foremost responsibility is to the most precious resources we have within the health department, which is the people who work here. And I believe fully that when you focus on things that are foundations of how we treat each other at work, when there really is safety to speak up when there's a concern or an issue, when there's consistent reflective feedback and follow-up when there are concerns raised, and we empower and provide a voice to all levels of employees, they stay even when there's competing sectors. And that's something I've found to be true within Texas, where there's certainly a lot of competing sectors. And I believe that it's again, a driver of getting toward improved health outcomes when we can really focus on those things within our workplace culture.
Great answer. Thank you, Lindsay. So my apologies. I'm just being a poor mute etiquette person. My apologies. Okay, so what I was saying when I did not have my microphone on is that I'm now going to ask a question from our Facebook Live users. This question has gotten 4 positive reactions, so I think that folks are going to be pleased we're asking this one. This question I'm going to pose to all 3 panelists, and I'll start with you, Leanne, go to Paula, and then Lindsay. So this question is a little bit long, and I will read it twice for you all. Where do you see opportunities to build on Benton County Health Department's long-established integration model with the community health centers of Benton and Lynn counties to advance primary care and behavioral health care access for low-income and rural residents? I'll do that one more time. Where do you see opportunities to build on Benton County Health Department's long-established integration model with the community health centers of Benton and Lynn counties to advance primary care and behavioral health care access for low-income and rural residents? Ooh, that was a whopper. All right, Leanne.
Thank you. It is a great question, and there's no one to clarify it with because it's from Facebook Ether. But the question is about improving primary care and behavioral health care access, I believe. So I'm going to answer it from that, which I think that there's a ton of room to take opportunity to leverage a longstanding relationship with public health and healthcare delivery service. And there's a lot to talk about. But if what we're talking about specifically is improving access of primary care and behavioral health care access for priority populations, I do think that there are programs that we typically deliver in the public health sector, which are outside of the healthcare sector. And the important thing is to build the the connectivity so that there is the referral back and forth between the community health programs, and then using the community health programs to refer people into the healthcare system and the behavioral health system. I do think that public health systems can and often are designed to be very inclusive of many diverse members of a community that may not already be linked to healthcare and behavioral health, and that is the opportunity to run it in that direction. I think usually people ask this question from the other direction, which is how do we use healthcare in a community to improve overall community health? So I'm definitely curious about what, you said there were 4 likes on this question. So I think maybe as I listen to others, and unfortunately it's hard in Facebook to do that feedback piece about what information we're after, but I do think it's tremendous benefit to have the programs together, and there's tons of opportunity to refer back and forth between healthcare and then the community health lens on how that works.
Great, thank you. Thank you, Leanne. Lindsay.
Okay. I think that, what was described in the question was something that was very crystal clear in the community health improvement plan that Benton County has put together with all of its stakeholders and staff. My commitment would certainly be to continue that work and to make it stronger to the extent that there are spaces that require some strengthening. But I would actually reflect that question back to the community. I would not come into a leadership role presuming that I know where those areas are that need to be strengthened. If I were to be selected, I would see my role as building a structure and support system to glean the expertise from the community, to ask tough questions, to say, where is the current state, what's working and what isn't, and then glean the innovative ideas from the team on where there are things that need further nuance or help and support. So my job again would be to look at the current state of affairs and look to all of you in the community to see where we need to strengthen to build on those initiatives and advance them further.
Thank you, Lindsay. Paula.
Okay, so I like the word opportunity in that question, and it's interesting when you go from different areas how the health department and how federally qualified health centers are connected. We have clinical services in our health department, and we partner with federally qualified health centers. We actually have 2 within Pima County. But one of the things that our health department has recognized is that there is an ongoing shortage of public health nurses. They're very hard to get and they're very hard to retain. And so we've just started conversations with our federally qualified health centers to partner to take on some of our clinical service roles. And so to see the relationship that is here in Benton County, I found very exciting to know that, again, it's that kind of a no wrong door policy that when somebody engages in either setting, either in the federally qualified health center or in the health department, that both of those organizations are aware of what the other does and they can make that referral, hopefully appropriately, to the other setting. So I found that really exciting to think, where can we build on those relationships? The other thing that ran through my mind with this question is something that we did about 3.5 years ago. We had a PHI innovation grant, and we started a group. It was called Mama, and it was working with mothers who were at the poverty level or below. We were they did a 12-week curriculum, and they learned about a variety of things. Goal setting, how to do finances, how to engage. Unfortunately, several of them, or many of them, were involved in the correctional system. And we thought that we were going to go into this grant and this project by connecting them to community services and helping them to be more engaged with those community services. And what we actually found was they know the community services. Those populations know the community services better than we do, or what we thought we did. But the piece that was invaluable to the health department and to the federally qualified health centers is to take that group and ask them, what are the barriers to those services? What are the barriers to you coming into our clinics to get our services? And so we actually brought the moms in. We had them facilitate conversations with staff from the health department, with staff from the correctional system, with staff from the federally qualified health centers, and with the hospitals. And they asked the difficult questions, and they really helped us identify holes and barriers so that we could change our service to the clients and to our customers. We continue to work with those groups of moms because there's always something new that comes up. There's always a new issue, and we see that especially right now. People choose not to engage in the healthcare system. So we reached out to them and asked them, we know that people are struggling. We know that people need to be seen. How can, or what do we do to make sure that people feel that it's safe to seek the medical care that they need, that it's safe to take their child for their immunizations, because that's still very important. So I like the word of opportunity. I think it's important. The community has a voice. They know the issues sometimes better than we do. And I think there would be, at least what I see with the community engagement in Benton County, I think that that many of the community partners and the department could probably gain a lot of wonderful benefit from conversations like that.
Thank you, Paula. I'm actually going to stay on you for our next question. So my next question to you is, in your experience, how do you judge employee satisfaction?
Oh, I think there's so many ways. Employee satisfaction is huge to me. Workforce development is very important to me. One of the things that I've tried very hard in my role as the deputy director, and I think it's even important for any supervisor or manager, is to do constant check-ins. And so right before COVID hit, I made a decision to meet with each and every new employee that came into our department. We do an hour lunch. They have my undivided time and attention. They're new, so they don't know a lot yet about the department. And it's just I felt an opportunity for them to feel comfortable with me. And so if issues and concerns came up, that they would be able to come back to my door and bring those concerns. I check in on them again at about 6 weeks, and then I check on them again about 12 weeks. The other thing that I helped work with our senior leadership is to do what we call stay interviews. So our employees that have been with us for more than a year, they have the opportunity to make an appointment with either myself, with one of the senior leaders, and to sit down and have a conversation about where they are at this moment, what are their goals, how can the leadership team help them to obtain those goals or that professional development. And so those are some of the pieces that I think are important. There are lots of other things that I would love to bring to the table for employee satisfaction. I think it's really important that people feel like they're being heard and they're being listened to. I was ever so grateful, not that I wanted to go through this COVID response, but being the incident commander and working really at the ground level again, working with our staff every day. Well, not all of our staff, but a lot of our staff, helped me to really see the things that our employees are experiencing. So when they say that they were having poor communication, I was experiencing poor communication. right there along with them, whether it was from a community partner, it was from, you know, higher administration. It really helped me to gain perspective, and I think it's really important for us to have those conversations from the frontline staff up, and so that we are, so that they know that they are being listened to, that they're being valued, and that they're actually seen as a voice and a leader in the organization.
Thank you, Paula. I loved hearing about those stay interviews and the lunches. That was really great. So my next question is going to be for Lindsay. Lindsay, could you talk about your perspective and orientation towards when to be the leader with a vision and when to be the facilitator who discerns and supports the vision of the community? And let me know if you want me to ask that one again. I'm happy to.
I think I've got it. The notion is when to be the visionary and when to be the support of an existing vision. And I think that by definition is what a leader does every day, right? There are components that if I were selected, I would certainly bring a perspective to the table on food systems, for example, because of the work that I've done in that in another state. And so I likely would make that a priority area for me to learn about, because it's something that you've already identified as a key priority within your community health improvement plan. And I would have a level of expertise that I could hopefully slide in and offer some assistance and, you know, perspective from another state. But I think by and large, in my experience in leadership is really influence. And so where there is already a vision set, particularly in a community like Benton County, where there's so much engagement and buy-in to the process of creating a vision and a strategic plan, my role would be to help influence that plan moving forward. And so I think, you know, in the way that I've approached any position in my career, it's really navigating a balance of those two circumstances at any turn. It's not my role to come in and set a new course when there's already a vision in motion that makes sense for the community, that the community was engaged in building. It would be my role to come in and support that and help drive it further in the direction the community already decided on. So I think in general, that's kind of how I approach coming into a new organization and the balance between those two opportunities.
Great, thank you, thank you. Leanne, this next question is for you. What similarities between your current role and the role in Benton County do you see? And how could these similarities help you serve our Benton County communities?
I think the similarities are enormous. I am a local public health director in a rural corner of Colorado with 2 counties, 4 municipalities, 1 population center. That is where the majority of the residents live. So I think there's a lot of commonality there. Benton County is a larger county than the 2 counties that I'm currently serving. But I think the similarity in the roles are leading through a difficult time for public health, where there is a lot of attention to what the community's needs are and tracking that back to the work that's already been done in the community to engage and determine. I think, as Lindsay just described, there's a public health improvement plan or a community health improvement plan. A ton of work went into that. That work exists, it's important, it needs to get done. It will also make controlling for communicable disease more successful, and that is the work that I'm currently doing in my current role that I see as a very similar task that will need to be happening in Benton County and in every public health or health department around the country.
Great, thank you, Leanne. So I am going to head back over to Facebook Live and ask a Facebook Live question. This one has 5 positive reactions, and there were some similarly themed questions on GoToWebinar. So I'm going to pose this question to all three candidates. I'll start with Lindsay, go to Paula, and then finish with Leanne. And this one's sort of long again, so I'll be happy to say it twice. The Benton County community embraces diversity, equity, and inclusion, and it is an integral part of the health department's work and the community we create. Why do you think it's important to address diversity and racial equity issues in this position? And what are some ways that you might do that? Okay, Lindsay?
So that is a great question. And it's not the first time that I've been asked some iteration of that question since I've been here. I think every panel member, every panel that we've been a part of to date today has asked something along these lines. So it's clear this is a very big driver for your community, which is amazing and commendable. I want to sort of start by saying just my value system around this question. I think that when you come from a experience, it is a completely different perspective that you bring from to the table than when you have not lived that experience. And the embodiment of that to me is really having been a breastfeeding mother who struggled intensely in the first 2 months of nursing my child with mastitis and plugged ducts. And at 2 a.m. needing that emergent clinical level care in order to continue to meet my breastfeeding goals and meet the needs of my child. When I came to the Texas WIC director role, I used that experience in my leadership perspective to increase access to breastfeeding support for all women in Texas, regardless of whether they were on WIC or not. And so I share that to say that when we talk about those who are in underserved communities or who are coming from a place of trauma or are in community groups that are underrepresented in what may be happening in terms of health outcomes or access to care, they have unique stories and experiences that drive their engagement with our community health system and also that drive their health outcomes that I don't have the experience in. And so the way that I have always come at that question is that their voices have to be included in our design. Their voices have to be included and at the table on the front end and how we determine to deliver services and how we gauge whether we're successful or not, and in how we determine our community's success in the way that we're serving. In Texas, we have a very diverse population, and some of the ways that we've done this, of course, are traditional through focus groups and survey design and things like that. But I will say that with my experience in Texas, one of the challenges we've had with that is some of our communities that we're hoping to help will answer those surveys with the desire to please the person asking the question. And we had to find new innovative methods for collecting qualitative data from some of these groups in order to make sure that what we were designing in terms of our public health systems were going to meet their needs. So all that to say, I echo the priority. I believe in it fully. And I think one of the things that I bring to a position like this is knowing that I have blind spots. And the really necessary component of needing to include those that you're trying to make a difference in the discussion, in the framework, in the evaluation to drive your service delivery.
Thank you, Lindsay. Okay, I think, oh, there's a little delay with my camera. That was a little bit weird, sorry. So, okay, I think we're headed now to Paula.
Oops, sorry.
No problem.
There we go. Yeah, that is a really good question, and I share your statement that is something that you can tell that both the department and the community, I think, are very passionate about. We've heard it several times over and in a lot of different ways, being asked the same question. You know, equity and diversity, I think, is something that public health is really just starting to do somewhat well. I don't think public health does it very well yet. I think there is a lot of room for growth, and I think there's a lot of research yet to be done. I feel that it's really important that with those conversations about equity, about diversity, and about trauma-informed care and resiliency, we have to not only educate the community, and I see that there's been a lot of ongoing conversation and I believe education for the community. I think it's really important too that we do that within the department and across departments. And I think we all come to it from a different perspective, a different lens. My trauma looks different than your trauma, but we need to be open and mindful and respectful of each other's experiences. I think it's important that sorry, I lost my train of thought. I think it's really important that we bring and we make opportunities available for the diverse populations that you have within the community to have those conversations. They need to be present at the table, and I think we have to, a lot of times with these conversations, we're not bringing them to us in the department, but we're going into their to their community center, into their setting. We are bringing their trusted individuals in the community alongside staff and people from the health department to help facilitate those conversations. I think it's really important, again, like I was explaining with our MAMA project, that we bring people who are really experiencing it, and whatever the life experience might be, and have them explain it to us, because again, our lens may be different than their lens, and they have some of the best ideas and some very innovative ideas on helping an organization to begin those conversations about equity, making sure that we are being diverse in our programs, and that we're trying to be inclusive of all of the populations that are within a community setting.
Thank you, Paula. Okay, Leanne.
Okay. So first of all, I share the observation that I think this has come up at every panel. So we know that as applicants, that this is very important work to this community. And I think it has been couched as diversity, equity, and inclusion work. I think I'll start by saying there are tremendous differences between diversity, equity, inclusion, and equality. And the first thing is getting rigorous around what the definitions of those words are. They're not just words, right? They are kind of strategies for giving all of us the best opportunity to have our greatest potential of health met. It is I almost used a really harsh word and say it is really difficult to believe that we live in a country today where depending on the color of your skin is going to determine how long you live and what opportunities you have as an individual. That is something we have to acknowledge, we have to address. We live in a country where who you have sex with determines things like your risk factors for communicable disease, for behavioral health, for increased risk for suicide. This is stuff that we need to get comfortable talking about, bringing up in community, bringing up in discussions and saying, this is real, this is valid, and what do we do as a community to get rigorous about addressing these issues? So diversity is how we get all of the individuals, with the different lived experience under the tent, having the same conversations. Inclusion is how we stand up different voices and recognize that our institutional bias and the structures that we have do not allow every voice to be heard. That is a role for public health. Public health needs to lead this in communities, because if we don't, who will? It's just that simple. And then equity is the North Star that this work gets us going in that direction. It is looking at strategies in every aspect of your organization. What are our hiring practices? What organizations do we collaborate with? Who do we have relationships with? And how do we honor that these are really hard conversations. They're uncomfortable conversations, but if we don't put ourselves out there and do it, we're not going to be successful. And Benton County Health Department is a government agency, so we're going to have to find partners to do this with, because not everybody wants to do diversity, equity, and inclusion work in government roles, because there are barriers there. And there are things we have to discuss about why that is and how we build relationships to achieve what we need.
Thank you, Leanne. Absolutely. I appreciate the passion of your answer. So a quick time check for our attendees and our panelists. We have 20 minutes left in our event tonight, and I'm going to save a few minutes at the end so our County Administrator Joe Kirby can offer some concluding comments. So I'm going to ask the next question, anticipating that it's probably going to be our last question. So I'm going to pose it to all three candidates. Several participants on our GoToWebinar have been asking about, they've been asking our candidates to speak about our other health services within the health department. For example, behavioral health services, mental health services, environmental health, and developmental diversity. So the specific question is, what is your understanding and experience with the other services provided by the health department? So Leanne, why don't we start with you, go to Paula, and then Lindsay. And I'd be happy to answer the question again if you guys would like me to.
Sure, if you could run through it one more time, that'd be great.
No problem. What is your understanding and experience with the other services provided by the health department? For example, mental health, behavioral health, environmental health, and developmental diversity.
Thank you.
Of course.
We talked about this a little bit earlier today, which is figuring out how to run a community health assessment and get feedback from a community about what's important. Acknowledge then an added challenge of having a global pandemic, and then recognizing that there are many things that happen under the roof of the health department that are inordinately important and cannot be thought of to the other services. But that this is the nature of when you are asked to do a community health assessment and have that kind of engagement with the community. People will give feedback around what is top of mind at the time that we're doing the work, and it sort of can relegate other services to other services. They are not other services. They are integral parts of everything that we do together to improve health in a community. So I think from the behavioral health, mental health side of it, the mind-body connection and the way that we work on what we as a community, improving behavioral health and improving physical health, and understanding those intersections, working on those together, recognizing that nothing happens in a vacuum, and this is all part of overall community health, I think is absolutely important. Developmental diversities is something that I am not currently working in my current organization. I will say that one of the things that we have done, we had been doing a lot of local public health, what's the word I'm looking for? Emergency operation preparedness for a long time leading up to this pandemic, and had done a tremendous amount of work in building relationships with the developmental diversity organizations, because we identified a need for an emergency operations lens for priority populations. That is something that we recently put in place. We're thankful that we did, because clearly that work has impact from this pandemic as well. And then on the environmental side, I think that there's so much room to look at the intersections between environmental regulations and health equity. There is a tension all the time in those two disciplines, because the more we regulate, the more unattainable basic services become. And these are the conversations that we have to have when we're looking at things holistically. So I do have the experience of leading the environmental regulatory programs in my current role, and do take that lens, apply that lens to it. Thank you.
Thank you, Leanne. Okay, Paula, would you like for me to repeat the question, or are you okay to answer?
I think I'm okay to answer that question. You know, one of the things that I was very excited about when looking at Benton County was, again, that relationship with the health department, with the federally qualified health centers, but the strength that I saw of the behavioral health component and the connections of the behavioral health pieces with the homeless population here in Benton County, and how the two are really working together to support each other. You can't do many of the things that we do within the health department without touching a behavioral health component. And we know that with the homeless population, behavioral health is one of their most prevalent issues, along with substance abuse and misuse. And so I was really excited to see what the county is already doing and how they're serving the population in a variety of ways with both adult and children's services. I think that it's going to be an important part as we continue in this COVID response, because it's not going to go away for a while. And it's behavioral health and how we are responding and supporting each other during this this time of the unknown, with the increase of anxiety and fear, with people who have issues with substance abuse, also with domestic violence, making sure that we're able to support them during this time of isolation and the unknown. I also think that it ties into the conversations that this community has been having with the trauma impact and resiliency. So I think it looks like Benton County has put a lot of a strong foundation in place. And I am very excited by the behavioral health pieces. The environmental pieces, you know, environmental is so difficult, and it's difficult right now. Because of the COVID response, we have to be mindful of the mitigation pieces, but there's also the pieces that we still need to be thinking about. I don't know what it is here as far as when I think environmental health, I also think of vector and vector control and the communicable disease aspects of those. And so while we are in this emergent or this sustained response, we still have to be doing all of our restaurant inspections. I feel very strongly that those pieces of consumer health and food safety are a piece of education and not enforcement. I think that you get a better partnership with our community businesses when we work as an educator and not an enforcer. There are times where we will have to do enforcement, but I think it's better for both the business and for the employees and for the department when we come about it in that way. It's also very important to be looking at our communicable disease and what are those things that are going on with our vector, mosquito season, and rabies, and all of the other pieces of environmental health. You know, one of the things that I think public health has not done well with yet, but I think we have to become more mindful of it, is climate health and the impact that it has on our community and our residents. For some people it's heat, for some people it's cold, but it does have an impact on the health of the lifespan, the very young and the very elderly. So I think the pieces that I heard today about environmental and to see what the community, how passionate the community is about environmental health, I'm very excited to have seen too. Sorry.
No problem. Thank you, Paula. And Lindsay, would you like to answer this question for us?
So in trying to read up and study before coming to Corvallis about what was in motion in Benton County, it was easy to see that there were distinct programmatic areas for behavioral mental health, for environmental health, and for developmental diversity programs. And there's quite an array of offerings under those umbrellas that I certainly learned a lot from your website. What I will say is that when I looked at the community health assessment and the community health improvement plan, those programmatic areas are not called out in a siloed manner. And that's intentional, and that's a strength to how your community is doing its planning. Because while internal to the organization, we may have distinct organizational charts and areas that we refer to or carry out responsibilities and roles within public health, what the community should see is a seamless approach. An environment in the community where you can work, live, play, and succeed in ways that your health is supported, and it sometimes is invisible in how that happens. You asked a little bit, not just about our understanding, but our experience in that realm, and what I would offer is in the WIC role, in the WIC director position that I was in Texas, it's a public health nutrition program. Right, we're seeing mothers and babies with the distinct goal of improving their nutritional outcomes to improve maternal and child health. We're screening them for nutrition. We are helping them with their breastfeeding goals. We are looking for things that are problematic from a nutrition risk perspective and prescribing a healthy food package in order to meet their needs. But when that woman and her baby come through our doors, we are also screening her at times for lead poisoning. We're screening her for postpartum depression, and we're looking for whether she might be a victim of abuse or neglect. Oftentimes, we're even catching safety net diagnoses for that child that perhaps hasn't even been to a pediatrician yet, that might have a developmental delay or disability. And so while they may come in through the WIC umbrella, behavioral mental health, developmental diversity, and environmental health play a role in us being successful under the umbrella of WIC. And I think that in what I could decipher through the conversations I've had today with your community partners and with your organization, and what I was able to research from your website, it appears that while those programs are distinct, they are integrated in the way they play out within the community. And I think that speaks volumes to the way you approach public health here.
Great. Thank you so much, Lindsay. So we have about 8 minutes left. So at this point, I'd like to hand it over to County Administrator Joe Kirby to offer some concluding thoughts.
Thank you, Lilia. Again, everyone, thank you so much for taking time to participate in our virtual town hall this evening. I hope after spending the last 60 to 90 minutes with us tonight that you now have a recognition as to why these three candidates made it into our final interviews. They all three are very intelligent, passionate, and very committed to the public health of their communities. And that's the reason that they're in front of you tonight. We look forward to receiving your feedback and input regarding each one of the candidates. And I would like to just recognize that they've been through a grueling process so far today. They've probably been at this probably 11 hours now, I think, but I've been able to spend a lot of time with them today, and I'll look forward to spending more time with them tomorrow. Today, they actually went through 3 separate panel interviews. One panel was a leadership panel, which was made up of community leaders as well as organizational leaders. Another panel was made up of employees that would report directly to the health department director. And then a third panel was made up of our Board of County Commissioners. Tomorrow morning, I have the opportunity to meet with each one of the candidates individually. And then lastly, tomorrow afternoon, they will be going through a virtual town hall meeting with our health department employees. So once again, you can tell that the process has been extensive and grueling, and I've been very impressed with their answers and with their knowledge. And I think we'd be very lucky to have any one of the 3 candidates that we've presented to you tonight. With that being said, please submit your comments through the link, both in the Facebook Live as well as the GoToWebinar, I believe. I have to look to our communication folks. They're the ones that are experts on this, not me. But we look forward to reading all of your comments and taking those into consideration as we decide who will be our next health department director. Thank you.
Thank you, Joe, for offering those closing comments. So before I close off for the night, I just want to offer a sincere thank you to our Human Resources, IT, and Board of Commissioners staff. We couldn't have made this happen without them, and they've been working diligently behind the scenes, so thank you to them. Thank you to all of our community members who took time out of their evening to join us tonight. We sincerely appreciate your engagement. And thank you especially to our Health Department Director candidates for taking the time to engage with us. So go to webinar candidates. When I close this webinar, a internet browser is going to pop up and you will have access to a survey to submit at that point. Our Facebook Live users, we are going to chat the SurveyMonkey link to you. And then if you have any close friends or colleagues that were hoping to be at tonight's event but just weren't able to make it, we're going to have this recording available tomorrow on our YouTube channel as well as on our Facebook channel. And so be sure to let folks know they can watch the recording over the weekend, and they have until 8 a.m. on Monday morning, August 10th to submit feedback. Again, thank you all. Have a great night.